Now, before you rush out to buy black seed oil, you need to know about 3 groups of people who should never take it. These aren't minor side effects, these are serious safety concerns that could land you in the hospital. Warning number 1, if you're taking blood pressure medication, this could be dangerous. Black seed oil naturally lowers blood pressure. That's great if you have high blood pressure, but here's the problem. If you're already taking blood pressure medications like ACE inhibitors, beta blockers, or diuretics, adding black seed oil can cause your blood pressure to drop too low. Here's why this happens. Black seed oil works on the same pathways as many blood pressure medications. It helps blood vessels relax and makes it easier for blood to flow. When you combine this with prescription medications doing the same thing, the effect gets multiplied. We're talking about hypotension that can cause dizziness, fainting, heart palpitations, or even stroke. I've seen people end up in the emergency room because their blood pressure crashed when they combined these. The dangerous part is that this drop can happen gradually over days or weeks, so you might not notice until it becomes severe. Signs to watch for include feeling lightheaded when you stand up, extreme fatigue, blurred vision, or confusion. If you're on any blood pressure medication, you absolutely must talk to your doctor before trying black seed oil. They may need to adjust your medication doses or monitor you closely with regular blood pressure checks. Warning number 2, pregnant and breastfeeding women should stay away completely. Black seed oil affects hormone levels and can stimulate uterine contractions. During pregnancy, this could potentially trigger miscarriage or premature labor. The compounds in black seed oil, especially thimaquinone, can cross the placental barrier and affect the developing baby. These same compounds can also stimulate prostaglandin production, which are the hormones that trigger labor contractions. Even in small amounts, this could be enough to cause problems, especially in the first trimester when the pregnancy is most vulnerable. There simply isn't enough research to know if it's safe during pregnancy, and the potential risks are too serious to ignore. The same goes for breastfeeding mothers. We don't know how much passes into breast milk or what effects it might have on a developing baby's immune system, liver, or brain development. Some studies suggest it could affect infant growth patterns, but we just don't have enough data to say for certain. When it comes to pregnancy and breastfeeding, the rule is simple. If we don't have solid safety data, don't risk it. Warning number 3, if you have bleeding disorders or take blood thinners, this is a no-go. Black seed oil affects blood clotting. It can increase bleeding time, which means if you get cut or injured, it takes longer for the bleeding to stop. Here's what happens. Black seed oil affects platelet function. Platelets are the tiny cells that help your blood clot when you get injured. The oil makes these platelets less sticky, so they don't clump together as quickly. This is similar to what aspirin does, but we don't know exactly how strong this effect is with black seed oil. If you're taking warfarin, aspirin, clopidogrel, or any other blood-thinning medication, adding black seed oil could increase your risk of dangerous bleeding. We're talking about bleeding that won't stop from minor cuts, spontaneous bruising, or internal bleeding in your stomach or brain. This becomes especially critical if you're scheduled for surgery. Even minor procedures like dental work could become dangerous. You need to stop taking black seed oil at least 2 weeks before any surgical procedure to avoid excessive bleeding complications. Tell your surgeon about any supplements you're taking, including black seed oil. They need to know because it could affect how they manage your care during and after the procedure. Let's talk about proper dosing because more isn't always better. For general health maintenance, 500 milligrams daily is sufficient. If you're dealing with a specific condition like diabetes, inflammation, or autoimmune issues, the therapeutic dose is typically 500 milligrams twice daily. That's 1,000 milligrams total. Never exceed this without medical supervision. And before you go, did you know black seed oil becomes even more powerful when mixed with honey? In the next video, I'll show you why this combo works and 3 other powerful mixtures most people don't know about. Make sure you watch the next part.